This is Dr. Lam. A chronic fatigue syndrome is a condition of a prolonged and severe tiredness or fatigue that is not relieved by just rest, and it is not directly caused by other more acute situations. To diagnose with this condition, you must have the main symptoms, which are, number one, prolonged fatigue and tired lasting at least 6 months and not relieved by bed rest. In addition, the fatigue must be severe enough to restrict activities that normally people do by at least 50%. Because the symptoms of chronic fatigue syndrome can be so complex, there are many other various minor symptoms that goes along with it. For example, fatigue that lasts more than 24 hours after an amount of exercise that would normally be easily tolerated is experienced. In other words, the body feels drained after a normal exercise period. Number two, there could be a feeling of unrefreshedness after you have a full night of sleep. In other words, you wake up kind of feeling drained. Number three, you can have symptoms of forgetfulness or brain fog, including difficulty in concentration as well as confusion. Number four, there could be signs of irritability as well as anxiety. Number five, there could be different forms of headache that is different from previous type of headache, because many people have headaches and it's one of the things very common, but this kind of headache that comes with chronic fatigue is very different from the ordinary headaches that a person usually gets. Another one, a joint pain that sometimes can move from place to place, of what we call migratory arthralgias. But it does not come with any joint swelling or redness, but you have pain of unknown origin in the joints. One of the important symptoms that also commonly comes up is a lymph node tenderness, especially in the neck and in the armpit. Some people can have a mild fever of 101 degrees or less in Fahrenheit. And of course, muscle ache or myalgia is common and not real well defined in terms of a consistent place. Lastly, you can have muscle weakness over multiple locations not explained by any known disorder. The exact cause of chronic fatigue syndrome is really not known. Some people suspect some type of viral etiology, such as Epstein-Barr virus or human herpes virus, HHV-6. However, no specific viruses has yet to be identified. It has been shown, however, that the CFS may be caused by inflammation along with the nervous system, and this inflammation may be some sort of immune response. But again, there is no specific scientific studies to prove or disprove this as a causation factor. Other factors such as age, prior illnesses, stress, environment, or genetic may also play a role. And CFS is most common in women, occurring from age 30 to 50. The Center of Disease Control, the CDC, describes CFS as a distinct disorder with specific symptoms and physical signs based on ruling out other possible causes. It is estimated that a lot of people suffer from this condition, although the exact number is really not known. The differential diagnosis of chronic fatigue include drug dependencies, immune problems, infections, neurological symptoms such as those associated with multiple sclerosis, endocrine diseases such as hypothyroidism, as well as heart, kidney, and liver diseases, and many mind-body conditions with psychiatric and psychological illnesses, particularly depression. Also, one that is seldom looked into and not so recognized by conventional medicine is adrenal fatigue, which we will address later. The diagnosis of CFS must include a few things. Number one is the absence of other causes of chronic fatigue, excluding depression, at least 4 other symptoms that's listed, as well as an extreme prolonged fatigue. Again, there are no specific test result to confirm the diagnosis of CFS. Sometimes the brain MRI can show some swelling in the brain and in destruction of some of the nerve cells, or what we call demyelinization. As well, sometimes there could be a high level of specific white blood cells compared to other types of white blood cells, specifically CD4 T cells versus CD8 T cells. There are also specific white cells, lymphocytes, that contain active form of EBV or HHV-6, as we talked about earlier, as a viral etiology. The prognosis of CFS varies. The long-term outlook is variable, and it's very hard to predict. When the symptoms first is reported, and if it's able to recover within 6 months to a year, then the prognosis is better. Otherwise, many people can go on for years, and a small number of people actually get worse. Treatment of CFS can include antiviral drugs to fight yeast infection, medication to reduce pain, discomfort, and fever, medications to treat anxiety, as well as medication to treat depression. If you have fatigue lasting more than a few months and fail to resolve, and it's getting worse, you should see a doctor and have a investigation. Now, as we talked about earlier in terms of the treatment, most of it is symptomatic relief, and if it is a viral cause, then some of the antiviral drugs can be helpful. Now, if you have a chronic fatigue or you're told that you have fatigue but you don't know what the reason is and things are not getting better, then it's time to also consider other alternative things outside the box. And I want to talk to you about adrenal fatigue in its relation to CFS today, because this is so commonly overlooked and seldom paid attention to, not only by conventional medical doctors, but also in the alternative field as well. In adrenal fatigue, we know that the collagen and proteins are broken down, and the body is usually in a catabolic state of function. And this can cause and lead to chronic pain syndromes with joint pain, chronic fatigue, and fibromyalgia. In other words, when your adrenals is not working well, and remember, adrenal gland is the one that really is the stress control center of the body. If it is not working well and it becomes fatigue, then the body's ability to make a cortisol is reduced. And as a result, the body's muscle has a tendency to be broken down for both nutrient as well as inability to deal with the stress and strains of life. And as a result, you can have muscle pain, and pain very similar to that of chronic fatigue, as well as fibromyalgia, as a matter of fact, on this situation. And the presentation is very confusing, including joint pain of unknown origin, muscle pain of unknown origin, tremendous fatigue, and these do not get better with time. And if you give antiviral drugs, they will not get better, as well as antidepressants do not improve. Normally, our muscles go through anabolic and catabolic processes where you have a breakdown and you have a rebuilding process. But in adrenal fatigue, this process is skewed and there's more breakdown than building up. And as a result, not only the muscles is broken down, the collagen structure as well as the joint are also affected. And on top of this, in adrenal fatigue, you can have metabolites that are not able to clear out of the body on a timely basis, and they deposit in various joints and muscles and causing inflammation. And inflammation, as we know, is one of the key causes the body has to fight a foreign substance that does not belong. In the case of metabolites that are being deposited in the muscles or the joint, they can cause a pain. It comes as no surprise that secondary fibromyalgia and chronic fatigue syndrome are commonly associated with adrenal fatigue, and especially adrenal exhaustion when it's in stage 3 and higher. Many people come complaining of pain of unknown origin. If the adrenal glands are involved, then the fibromyalgia as well as the chronic fatigue syndrome is actually secondary to the adrenals. And the good news is, once you are able to deal and help the adrenal glands to repair and heal itself, then oftentimes the pain from the fibromyalgia as well as the chronic fatigue will eventually go away by itself. And that's the beauty of this situation. In other words, you fix the adrenals and the CFS will get better. Of course, adrenal fatigue can also have metabolic problems, neurological issues, hormonal system imbalances, as well as immune system imbalances. And I'd like to encourage you, if you have this concern, is to go to my website, www.drlam.com. That's drlam.com. It's a free educational website. And look for the article called Adrenal Fatigue-Related Health Conditions. And in this article, you will read it in full, and you will see a lot of conditions, especially CFS and how it relates to adrenal fatigue. If you have any questions, you can feel free to write to me directly, or if you need personalized attention, you can call my office.